Stroke may cause paralysis to one part of the body and the patient may find it difficult to walk. It is important that caregivers know how to assist the patient to walk so that the activity can be carried out safely and effectively. Make sure that you have received training by a physiotherapist before walking the patient with marked disability for the first time. Preparing the walking aid. Use the walking aid that is recommended by your physiotherapist. If the walking aid is a stick or a quad stick, it is always held in the stronger hand of the patient. For quad sticks, ensure that it has been adjusted to right or left hand use. Always remember that the wider and angled legs of the quad stick should be facing out. You can adjust the quad stick to a left hand or right hand use by loosening the screw and pressing the button and turning the base of the quad stick 180 degrees or simply facing the opposite direction. The height of the walking aid should be the level of the wrist of the patient when she is standing. Majority of the walking aids sold are height adjustable. Simply loosen the attachment, press the knob, and adjust the height by increasing or shortening the length of the aid. Patient safety advice. Ensure that suitable footwear is worn. Avoid walking with socks or slippers as the patient may slip on them. Ensure that pants are folded up if they are too long. This is to prevent the patient from tripping on them. Ensure that the environment is clutter-free and that the floor is cleared of false hazards like wires, shoes, and children's toys. Walking the patient. Always stand on the weaker side of the patient. Should the patient fall, she may fall towards the weaker side. You can place your hand lightly around the hips of the patient. Alternatively, you can also hold on to a belt or gait belt. If the weaker arm has no activity at all, you can support the arm lightly, or the patient can use an arm sling. This is to prevent gravity from pulling on the shoulder joint that can cause shoulder pain in the future. The patient can move her walking aid first, followed by one leg and then the other. Do not place the walking aid too far forwards. Instead, place it at one step length ahead. If you are using the quad stick or walking stick, place it ahead and slightly to the side of you. If you are using the walking frame, put it ahead of you. Do not walk right into the frame as the patient may lose her balance backwards. Leave some gap between you and the front of the frame. Always walk with an upright posture. Always be attentive and make sure that you are in a position to stabilize the patient should she become unsteady. Allow the patient to walk at her own pace. Do not push or pull. How to keep your home environment safe for walking. Room is well lit. Walkway is free of clutter. Ensure that the floor is dry. Loose rugs and cloth on the floor are removed. Non-slip floor mats are recommended instead. Shoes and footwear are not obstructing the doorway but are kept aside. Falls can have serious consequences. We strongly recommend that caregivers of patients with stroke consult a physiotherapist before attempting these activities for the first time. Physiotherapy service is available in all the public hospitals as well as rehabilitation centres in the community.